Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaj. NEETPG mock test 9. I hope you all answered the question paper. We already published the solutions on the learnograph.com as an ebook PDF containing the entire question paper along with the explanatory answers. But still, to motivate you, at least 100 questions, let us take up a discussion so that you are ready for the game. So this is the part of the 50 NEETPG full-scale mock tests. Before the June 23 of 2024, where you are going for the battle, let us do the revision of as many number of mock tests, almost 50 mock tests. Very nice to see Anita Rani, our future topper. I'm very confident on you, betting on you, Anita, and many more who are all online. So please inform your friends. Sorry, I got a little late in the hospital. I just came. But I don't go to sleep unless I discuss at least 100 questions so that you are motivated to know what are the right answers, wrong answers, strategize your preparation. The whole purpose of the mock test is like a litmus test to inspire you to read the high-yield topics. At least 10 points you should know about each of the high-yield topic, doctor. Yes. So let's make the great beginning. Can you please punch? Is the voice loud and clear for all of you, doctor? Now, very good. Okay, so assuming that you all have, can you please punch? Is the voice loud and clear for all of you? Yes, doctor. I'm just starting. I'm trying to. So, doctor, very good. Thanks for the feedback, Rajesh. Right. So, once you come download the ebook, you have the schedule of the program of the 50 granters. Then you have the PDF of the question paper. So, once you come download the ebook, you have the schedule of the program of the 50 grant. Yes. So once I give this PDF to all of you, once you answer all the 200 questions, then please do join the discussion because the discussion looks very fast. If you have not yet answered the question paper, but it looks very slow, if you have already answered and looking for a little explanation for each of the question. So with that, let us make the beginning, doctor. 34-year-old from the partner presents to the emergency. Chest X-ray has been shown to you. So what you can see in this chest X-ray, doctor, you're able to see a thin line of the pleura. So this is a classical example of a pneumothorax. So whenever pneumothorax is there, you need to do the decompression. Needle decompression is considered to be the management of choice. So What is tension pneumothorax, etiology, risk factors, clinical features, and treatment options? You need to be very sure. Every time in the NEETPG, one question is going to come on a chest radiograph interpretation, which you need to be very sure on the common conditions. A 32-year-old with a painful swelling of the right leg and shortness of breath. So what you're able to see on the CT, doctor, you're able to see the clot. So a wedge-shaped clot of pulmonary embolism. So pulmonary embolism is an indication for intravenous thrombolytic therapy is considered to be the treatment of choice is what you need to remember. Now, a 58-year-old from Pune with persistent cough, unexplained weight loss, and a chest radiograph has been taken. So what you're able to see here, classically, you are seeing a space-occupying lesion. So whenever the chest X-ray show a lung mass with a spiculated margin, that suggests that there is an invasion into surrounding tissue. So that means it is no more benign. It is more likely to be malignant is what you need to remember. So it is more likely to be lung cancer, a space-occupying lesion, which typically show spiculated margins. So what are these called? Spiculated margins is typical of lung carcinoma is what you should remember. Now, doctor, the next question. A 74-year-old former steel plant worker from Visakhapatnam presents with persistent cough. CT scan has been done. So what are you able to see on the CT, doctor? So this is the typical CT scan done. So in the CT, the frontal chest X-ray is showing a mass above the hilum of the right lung. Here you can see a mass. So remember, squamous cell carcinoma, small cell carcinoma are central. Adenocarcinoma is more peripheral, is what you should remember. So the CT is showing a mass which is located adjacent to the pleura in the anterior segment of the right upper lobe. So this is more likely to be the location is classical of lung carcinoma is most likely to be the diagnosis is what you need to remember. Now, doctor, a 68-year-old from Varanasi with exertional dyspnea, exertional syncope, and also angina. So clinically only you can say aortic valve is calcified is what you are able to see here. So this is a classical story of aortic calcification, and you need to do surgical valve replacement is the primary treatment. Transcatheter aortic valve implantation is for the high risk surgical candidates, and you need to manage with beta blockers, diuretics, etc., etc. So now, doctor, a 56-year-old patient with sudden severe chest pain radiating to the back. Radiating to the back. So you can see the widening of the mediastinum. Widening of the mediastinum is what you are able to see here, with a radiation into the interscapular area, which is very classical of aortic dissection, is the diagnosis of this case is what you need to remember. So these are all very classical radiological clinical vignettes which are frequently tested in the exam, doctor. A 64-year-old obese male with difficulty breathing X-ray is being done. So what you're able to see here, you're able to see all the interstitial pulmonary edema. So pulmonary edema is treated with oxygen therapy, and diuretics is considered to be the management of choice is what you need to understand. So doctor, a 58-year-old patient, uncontrolled hypertension, diabetes with shortness of the breath. Chest X-ray has been done. Once more, you can see the cardiomegaly, presence of interstitial edema, which is once more pulmonary edema, which is treated with intravenous diuretics and oxygen therapy is what you should remember. So now, a 34-year-old noticeable bulge in the scrotum that enlarges with the physical activity has got a discomfort. And a barium minima is being shown to you. So what you're able to see here, doctor, the classical scrotal intestinal protrusion in the form of hernia. So a scrotal hernia most commonly is the inguinal hernia, occurs whenever the tissue like intestine protrudes to a weak spot in the abdominal wall. If it passes through Hasselbalch's triangle, you call it as direct inguinal hernia. So the inguinal canal you call indirect inguinal hernia. So the bulge in the groin or scrotum that increases in size when standing or exerting and decrease when lying down is a classical feature. So what you see on the X-ray is a soft tissue which is visible through the scrotum is what you're able to see. And the barium enema is showing the bowel which is extending into the scrotal area, which is classical of inguinal hernia. 23, 21-year-old woman has not experienced menarche. Her bone age was considered to be 16 years. She is unable to perceive the smell. Olfactory dysfunction is there. And this is a very classical feature of a hypothalamic dysfunction leading to the development of amenorrhea, which is called as Kalaman syndrome, is what you need to remember. The classical example of Kalaman syndrome. So every explanatory answer contains mind maps, a quick snapshot of all the high-yield facts, doctor, in each of these questions. Now, a 20-year-old college woman with significant weight loss, amenorrhea, intense fear of gaining weight in spite of being significantly underweight. So this is typically, they have a psychological thinking that they have a dysmorphism of the body. So in all such cases, it is anorexia nervosa is the diagnosis where there's an extreme weight loss, severe restriction of food intake, distorted body image, amenorrhea, dry skin, brittle nails, brittle hair, sensitivity to cold, osteoporosis, which is typically called anorexia nervosa, is what you should remember. A 17-year-old with 46XY karyotype with primary amenorrhea, female external genitalia, bilateral inguinal masses, elevated testosterone levels. That's called androgen insensitivity syndrome. Fundamentally, they are males. Whatever the vagina you are seeing is a blind ending pouch-like vagina. And whatever the inguinal masses found are the testis. So it is called androgen insensitivity syndrome, where the karyotype is typically XY is the karyotype is what you have to remember. So every point about androgen insensitivity syndrome, one of the favorite questions of the examiner. A 45-year-old woman with heavy menstrual bleeding, frequent urination, histology of the uterus is being shown. So what do you see here? Uterine leiomyoma. You are able to see the muscle tissue. Uterine leiomyoma, fibroids classically present with this kind of appearance is what you need to remember. Now, doctor, the next question. During a routine pelvic examination, a middle-aged woman, an imaging study show large ovarian mass. What you are able to see? Large ovarian mass filled with gelatinous substance, which is classical of mucinous cystadenoma. It is a benign epithelial tumor of the ovary. Large cyst filled with gelatinous material, most common type of ovarian cyst arising from the glandular epithelium is what you need to remember. So I leave the literature for you. All the points about the ovarian cystadenoma, you need to be very, very sure about. Now, a 50-year-old woman undergoes routine pelvic ultrasound. What is the most likely diagnosis, doctor? So, what you are able to see in this ultrasound. So, there are complex ovarian mass which has got a cystic and solid components, echogenic nodules with the shadowing that can represent teeth, bone, or areas of dense fat, which is very classical of mature cystic teratoma is the diagnosis is what you need to remember. Now, a 42-year-old woman with rapid swelling, redness, warmth in her left breast, as what you can see here, redness, warmth in the left breast. They have developed very quickly in past few weeks. So what is your diagnosis? Inflammatory breast cancer typically presents with this kind of appearance. Everything, anything about it, you need to know, doctor, that redness, edema covering a third or more of the breast, and mammography and ultrasound are used to assess the breast tissue. Now, a 55-year-old woman presents with a history of persistent genital itchiness, and there are white patches on the labia, is what you are able to see on the labia. So, white patches on the labia and occasional bruising, but after treatment with the topical steroids, everything normalized and improved. So, what is your diagnosis, doctor? Lichen sclerosis. So, whenever there are symptoms of parchment-like skin, ecchymosis, figure of 8 involvement pattern of the vulva and perianal area, significant improvement with steroid, that is all indicative of lichen sclerosis is what you need to remember, doctor. Now, a 28-year-old came for evaluation of infertility, undergone the biopsy of the endometrium based upon the appearance, the histological appearance. So how is the histological appearance? Typically, endometrium passes through proliferative phase, occurs after menstruation until ovulation. Estrogen levels are very high, endometrial glands are straight, slightly coiled and tubular, pseudo-stratified columnar epithelium with notable mitotic activity characterizes the proliferative phase. Secretory begins after ovulation under the influence of the progesterone. Endometrial glands become more coiled and start secreting nutrients, and they are more columnar. So that is the reason. What is this, doctor? So this is typically proliferative phase, straight to slightly coiled tubular glands, lined by pseudo-stratified columnar epithelium. You can see the nuclei at multiple levels. Is very classical of the proliferative phase is what you need to remember. Once more, tomorrow's NEETPG ditto MCQ will come. You must be ready to answer the question, doctor. A 32-year-old woman who had MRI for headache and visual disturbances. Both the coronal and sagittal views have been shown to you. What is the most likely diagnosis? This is pituitary microadenoma. So typically microadenomas are very close to the optic chiasma, leading to the visual disturbances. A lot of these microadenomas are prolactinomas, leading to the development of amenorrhea in the case of the female patients is what you need to remember. 36-year-old with the lesions around the neck and armpits, which is very classical of acanthosis nigricans, which is seen with insulin resistance. So obesity, type 2 diabetes, polycystic ovarian disease, they're all the risk factors for the acanthosis nigricans is what you need to remember. A 23-year-old woman came for evaluation, reports early puberty, excessive body hair growth, elevated 17-hydroxyprogesterone levels. So what you are saying, doctor, typically there is clitoromegaly is what you are able to see. Hirsutism, clitoromegaly, elevated 17 alpha hydroxyprogesterone levels, they're all suggestive of 21 alpha hydroxylase deficiency is what you need to remember. So virilizing, clitoromegaly, elevated 17 hydroxyprogesterone. So one MCQ invariably comes on congenital adrenal hyperplasia, which you should be very, very sure about. A 13-year-old cyclical pelvic pain MRI T2 weighted image has been shown to you. There's a collection of the blood behind the hymen. So it is a classical transverse vaginal septum with hematocolpos. You are able to see when MRI has been done, the marked hematocolpos, this is the typical uterus in the cervix is being distended. So behind the septum with low signal intensity of the T2 weighted images indicate subacute blood collection, which is very classical of the transverse vaginal septum with hematocolpos is what you need to remember. Now, doctor, a 28-year-old woman came for the monitoring of the fertility. So what you are seeing here, doctor, this is called cervical mucus Ferning test. The cervical mucus typically which is being collected is showing a crystalline fern-like pattern, which is, the meaning is she is near the ovulation. She is in the mid-cycle. Around the time where ovulation is going to occur, around the time when estrogen is very, very increased, that is indicated by the fern pattern is what you need to remember. A 32-year-old woman undergoing evaluation for infertility undergoes a hysterosalpingogram. What you are able to see? You are able to see a lot of adhesions. Moth-eaten appearance. What is this called on hysterosalpingogram? Moth-eaten appearance, बच्चों. और इसका कारण क्या होता है? Asherman syndrome is what you should remember. 28-year-old undergoing investigation for infertility. You are able to see the normal uterus, fallopian tubes into which the dye is passing. That's the reason it is a normal uterine and the fallopian tube anatomy is what you need to remember. A 58-year-old with episodes of dizziness. So what you're able to see, you can see that there is a Venki back phenomena between P wave, between the P wave and QRS. In this wave, the next wave, P wave and QRS, there is an increase in duration. P wave and QRS, there is more increase in duration. And then you have only the P wave, no QRS. So it is an example of a Venki back phenomena in a second degree AV block of the Mobitz type 1 block is what you need to remember. In type 2 block, there is no such serial prolongation of the PR interval. Everywhere PR will be the same. Suddenly there is a drop of the QRS complex. Then it is called Mobitz type 2 is what you should remember. A 36-year-old woman comes to the emergency with palpitations. Episodes lasted for 45 minutes. So what do you see here? Narrow QRS complexes. Always remember, unless proven otherwise, narrow QRS tachycardia. So please don't forget, doctor. Unless otherwise proven, narrow QRS complex, narrow complex tachycardia is supraventricular tachycardia. Unless proven otherwise, broad complex tachycardia, BCT. Which complex? QRS complex. Broad QRS complex tachycardia, unless proven otherwise, is ventricular tachycardia. Narrow QRS tachycardia is supraventricular tachycardia. is what you need to basically remember, doctor. Right? So थोड़ा थोड़ा ईसीजी का ज्ञान बढ़ना है हमारे मन में. Definitely 3 to 4 questions will come from the ECG, doctor, in every NEETPG mock test, and I want you to answer all those questions perfectly well, right? Now, so this is a supraventricular tachycardia. I leave the literature for you. Sudden onset of palpitations, excessive caffeine, alcohol, stress, fatigue, structural heart condition, anything can trigger the supraventricular tachycardia is what you need to remember. A 28-year-old with recurrent episodes of palpitations, ECG has been performed. So what do you see in this ECG, doctor? You are able to see delta wave. You can see, in the initial part of the QRS complex, there is a little slurring. Why the QRS complex is there? Very short PR interval. Because normally PR interval is created by whom? PR interval is created by the AV node. But here, directly atrium is connected with the ventricle. That's the reason the AV nodal delay, normally which leads to development of the PR interval, is no more there. So short PR interval, wide QRS with the slurring, which is called delta wave, characterizes the Wolff-Parkinson-White syndrome. One of the favorite ECG in the tomorrow's NEETPG exam, doctor, you need to be very, very, very sure about the WPW syndrome. 45-year-old with COPD undergoes ECG. So what do you see in this ECG? Typically, in the 2-3 AVF, lead 2, lead 3, lead AVF, inferior leads. You see a prominent P wave. P wave इतना tall नहीं रहता 2-3 AVF में. अगर tall है तो एक ही बात रहता. Why it is so tall? It can only because of the presence of pulmonary hypertension, जिसके वजह से right atrium, right ventricle के ऊपर दबाव गिर रहा है because of the pulmonary hypertension that lead to right atrial enlargement, which is typically responsible for peaked P waves. How do you know it is peaked? If the height of this is more than 2.5 small boxes, then you call peaked P wave, which is classical of right atrial abnormality, right atrial enlargement, which is very common whenever a COPD patient is having alveolar hypoxia that lead to pulmonary vasoconstriction, that lead to pulmonary hypertension, which lead to the development of the right ventricular hypertrophy, leading to right atrial hypertrophy, leading to 2-3 AVF having prominent P waves. 2-3 AVF with prominent P waves is what you need to remember. A patient who has got aortic stenosis. So what do you see here, doctor? Very, very, very tall QRS complexes. So such a tall QRS complexes with the inversion of the T wave is called LV strain pattern. And V1 to V3, there is also ST segment elevation. So which is not uncommon whenever the patient has got such a severe aortic stenosis. Because of those elevated ST segment, people often with aortic stenosis undergo coronary angiogram. Ultimately, coronary angiogram will be normal in spite of ST elevation. And all that ST elevation is because of the left ventricular strain, left ventricular hypertrophy, which you see in the case of aortic stenosis is what you need to remember. A child is born with a raised red lesion of the skin. It has decreased significantly without any intervention. What do you see? Without any intervention only, it has regressed. So what is that? It is congenital hemangioma. Typically will show the regression. So in one mind map, I give you everything that you need, doctor. I'll give you the gist and summary. So you have 200 mind maps like this. Actually, you don't need even a discussion, but still I do discuss in order to stimulate you to take the test every day, to solve the question paper of most expected high yield topics, and then prepare for the exam with confidence. 50 full scale grant tests एक बार आप ले लिए तो automatically the actual exam is only 51st exam, which you will confidently score 160 plus correctly out of 200 questions. A biopsy from a patient with a poorly controlled diabetes, poorly controlled hypertension. So what do you see here? This is called onion skin concentric appearance. ये ऑनियन दिख रहे हैं ना आपको? क्यों बच्चों? ऑनियन दिख रहे हैं ना? सो इसको क्या बोलते हैं? ऑनियन स्किनिंग कहते हैं. ऑनियन स्किनिंग कहाँ होता है? हाइपरप्लास्टिक आर्टेरियोस्क्लेरोसिस में onion skin concentric laminated thickening and a obliterated lumen is very, very classical whenever the patient is having hypertension. 24-year-old, unequal blood pressures, giddiness, faint pulse in the left arm. It is also called pulseless disease. And if you happen to do the evaluation, what do you find, doctor? Aortoarteritis is the classical feature, where there is a narrowing, decreased blood flow to the subclavian, leading to pulseless appearance, presenting with hypertension. So Takayasu arteritis is a large vessel vasculitis affecting the aorta, is what you need to remember. बच्चों, मैंने बहुत कुछ डिस्कस किया था हमारे रेगुलर वीडियो डिस्कशंस में, राइट डॉक्टर? सो वेरी गुड, गौतम कुमार यलका, कीप पंचिंग योर आंसर्स डॉक्टर, राइट? सो आई गॉट very late from the hospital, but my day doesn't end. So today I had a 84-year-old patient. He had diabetes, on insulin, with recurrent UTI. Almost 4 times I went to the home, started on meropenem drip to treat his urinary tract infection. But today he became very sick, not eating food for the past 4 days. So I have to admit him. So when we admitted, we want to put Foley. Then we found a mass on the penis. So penile carcinoma is there in that 84-year-old. So doctor, life is a very enigmatic story. We think our life is miserable, remembering so many things to become a consultant. I mean, MD, whatever, MD, DM, whatever. But ultimately, you are all born to become great urologists, great cardiologists, great neurosurgeons, great nephrologists, to save the misery, comfort, palliate millions of people in this world. So always when you start your preparation, start with a prayer to God. Bhagwan, 1.5 million log कोशिश करे तो खाली 1 लाख डॉक्टरी पढ़ सकते. मुझे वो मौका दिया उस दिन. अभी मेरे सेकंड एग्जाम के चैलेंज में और एक बार मुझे वो हिम्मत देना, वो एनर्जी देना, वो मेमोरी देना, वो डिटर्मिनेशन देना, वो भगवान, ताकि हमारे हाथ कल एक बड़ा सर्जन बनेगा और अल्टीमेटली सर्व द ह्यूमन रेस. So once you approach the exam thinking that that is not the be all and end all, you are born to become great. There is nothing that is going to stop you. And I am there with you every day, sitting with you and preparing. Go to learnograph.com. Please download the ebook of solutions, 50 full-scale grant tests, exactly like the NEETPG will be uploaded. Already, this is the test number 9. Before June 23rd, you will have all the 50 tests. Solve it. These 10,000 questions से ही कल के NEETPG में जरूर आएगा. 200 out of 200, 100% strike rate. I promise you. कहीं भी आप कोचिंग लो, आप ऐप में पढ़ो, नहीं तो वीडियो लाइब्रेरी में पढ़ो, नहीं तो जाके क्रैश कोर्स में पढ़ो, कहीं भी पढ़ो. But ultimately, you require the 50 grant tests in the last 3 months with Dr. Murali Bharadwaj for you to get sufficient practice and do the revision of what all that you studied till now. So, doctor, with that preamble, let us fight the game of the NEETPG. Now, a 40-year-old, fever, weight loss, skin rash, and worsening renal function. Biopsy of the skin. So what is biopsy of the skin showing you, doctor? Typically, the ANCA-associated vasculitis. So what is this called as? Leukocytoclastic vasculitis, this is called as. So leukocytoclastic vasculitis is classical of ANCA-associated vasculitis, where granulomatous inflammation in the small arteries is what you're able to see on the biopsy. So every NEETPG, doctor, aap yaad rakhna, one MCQ will come invariably on the vasculitis. 54-year-old comes to the emergency with a chest pain lasting for 2 hours. Biopsy of the heart. What you are able to see here? Typically, you are able to see the neutrophilic infiltration with coagulative necrosis. The affected myocardial fibrils lose their cross striations and nuclei, but they maintain still that basic cellular outline. So indirectly, examiner is asking you, can you recognize coagulative necrosis on a histopathology slide, which is classically seen in the case of the acute myocardial infarction? A patient with a history of the sore throat followed by joint pains. You have done a myocardial biopsy. So what is this called as, doctor? This is called Ashkoff's nodule. Ashkoff body. It is circumscribed nodule in the myocardium where you get mononuclear inflammatory cells. Right, doctor? So very nice to see. Gautam Kumar. Excellent, doctor. Gautam, I am very happy at this 11th hour. You are very active, proactively punching your answers. That should be the spirit, doctor, that will keep you up and going. A patient with a history of the mitral valve prolapse. There are vegetations. Which organism is most likely responsible? So what you can see is, these are the typical infective endocarditis. Infective endocarditis. So the Streptococcus viridans is the most common cause of the subacute infective endocarditis, particularly when there is any pre-existing condition like mitral valve prolapse is there. Whenever infective endocarditis develops, that is called subacute endocarditis, which is typically caused by bacterial endocarditis, is caused by Streptococcus viridans, is what you need to remember. So the next question. A 45-year-old with a congenitally bicuspid aortic valve with very high-grade fever, heart failure, and echocardiogram. Echocardiogram reveals extensive cuspal destruction with a ring abscess. What you are able to see? A ring abscess. Such a destructive endocarditis is very classical of Staphylococcus aureus, which is very, very aggressive infection leading to acute endocarditis is Staph aureus. Subacute endocarditis is typically Streptococcus viridans. A 55-year-old, long history of gastroesophageal reflux, has got recent dysphagia. So what do you see in biopsy? You're able to see dysplastic changes. So typically, you're able to see a high-grade dysplasia where there is a pseudo-glandular formation with cribriform pattern, which is indicative of severe dysplasia in the Barrett's esophagus, is what you are able to see here, doctor. Now, a 68-year-old, weight loss, abdominal discomfort, endoscopic biopsy has been done. So what do you see here? Signet rings. Signet ring cells, which is classical of gastric adenocarcinoma of signet ring cell type. So that will be all about our 40 full scale, 40 MCQs which are image based. Typical NEETPG में 52 आजकल ज़्यादा बढ़ रहा है number of image based questions, but image based are more easier to solve. So doctor, 46-year-old, urine turns dark upon standing, alkaptonuria. So typically deficiency of the enzyme homogentisic oxidase. So it is the degradation of the tyrosine which is abnormal in alkaptonuria is what you should remember. 74-year-old with chronic renal failure, multiple pathological fractures, serum calcium 6.3, phosphate 4.7, parathormone 750. So basically whenever chronic renal failure is there, there is a secondary hyperparathyroidism and there is a decreased vitamin D levels, which is responsible for hypocalcemia, is what you should remember. 18-year-old who underwent thyroidectomy, if she misses her medication, which physiological process is more likely to decrease? You should remember thyroid hormone stimulates gluconeogenesis. So without it, gluconeogenesis will decrease, is what you need to remember. 3-year-old progressive loss of motor function, ataxia, cognitive decline. Then which enzyme deficiency lead to accumulation of cerebroside sulfate? It is the aryl sulfatase A. Aryl sulfatase A. It's called metachromatic leukodystrophy, is what you should remember. So all this mucopolysaccharidosis, lysosomal storage disorders, which enzyme for what, you need to be very, very sure for the tomorrow's NEETPG doctor. 6-year-old is brought with a bright red rash on the cheeks. Trunk and arms, it has extended. So slapped cheek appearance, it is typically called fifth disease, erythema infectiosum, caused by parvovirus B19, common in the children between 3 to 12. And it is often self-limiting. There is nothing that need to be used to treat it. A 60-year-old woman with a history of penicillin allergy, upper lobe consolidation, sputum analysis shows Streptococcus pneumoniae. So what is the mechanism of action of her prescribed antibiotic? So typically, whenever there is a penicillin allergy that prevents from using beta-lactam antibiotics, macrolides are the next alternative for a Streptococcus pneumoniae. Macrolides basically inhibit the protein synthesis by binding with the 50S ribosomal RNA, is what you need to remember. Now, doctor, 40-year-old woman hospitalized for aspiration pneumonia, treated with clindamycin, develops a crampy abdominal pain, diarrhea, colonoscopy showed mucosal erosion. So Clostridium difficile toxins A and B lead to colonic epithelial damage. Toxin B is the one which is implicated to lead to apoptosis, is what you need to understand in Clostridium difficile colitis. 18-year-old woman in the ICU develops urinary urgency, burning micturition, lower abdominal pain, urine culture show red pigment. So nosocomial UTIs can be caused by Serratia marasans, which typically lead to the red pigment production. 20-year-old has indurated mandibular mass for 4 months after the oral surgery, now with yellow exudate granules that suggests actinomycetes, which is sensitive to antibiotics that inhibit the cell wall synthesis. Cell wall synthesis. So the answer is option B, blocks the bacterial cell wall synthesis by inhibiting the transpeptidase cross-linking is what you need to remember. A 74-year-old diabetic woman with lower abdominal pressure, negative stool guaiac test, WBCs are there in the urine analysis, but no bacteria. So it is called sterile pyuria, such as UTI, very common in the diabetic patients. E. coli is the most frequent cause, even without a typical UTI symptoms, is what you need to remember. And it leads to development of pyelonephritis. 80-year-old boy with the fever, sore throat, swollen cervical lymph nodes, tonsillar exudate show gram-positive cocci. So that is streptococcal pharyngitis, which is caused by Streptococcus pyogenes, which is a group A streptococcus. Pyogenes is catalase negative, beta hemolytic, and sensitive to bezitracin is what you need to remember. So one question, invariably, every NEETPG comes, gram-positive, gram-negative organisms, their culture characteristics, which is catalase, novobiasin, bezitracin, sensitive, resistance, everything you should know, doctor, for the tomorrow's NEETPG. A patient has a sudden onset of the contralateral hemiparesis, hemianesthesia without headache. Imaging shows a hemorrhage in the deep brain structure. So all these symptoms suggest a hemorrhagic bleed rather than a ischemic event. Absence of headache and gradual worsening means it excludes cerebellar hemorrhage and embolic infarction. So that is the reason it is hypertensive hemorrhage happening in the basal ganglia is the most likely diagnosis in this case. So hypertensive hemorrhage, cerebellar hemorrhage, embolic hemorrhage, lobar hemorrhage, medullary hemorrhage, midbrain stroke, how do they differ from each other? What is their characteristics? You need to be very, very sure about, doctor. A patient with unilateral facial nerve palsy, swelling of the parotid glands and elevated calcium levels, hypercalcemia, facial nerve palsy, parotid gland swelling, classical of sarcoidosis, the triad of features. So once more, doctor, I leave a quick literature, a snapshot in a mind map by Dr. Murali Bharadwaj. So these 50 full-scale grantors have totally 10,000 MCQs, 10,000 mind maps. These 10,000 mind maps will give you the revision of at least 5 to 6 very important high yield facts. So these 50,000 high yield facts is everything about the NEETPG, doctor. You don't need anything else. If you are able to crack in Dr. Murali Bharadwaj full-scale NEETPG mock test, at least 160 correct out of 200, seat guarantee is what you should remember. Now, a diabetic patient, ptosis, down and out gaze, that means oculomotor palsy, but normal pupillary reflex. Always remember, oculomotor palsy can be due to surgical cause like posture communicating artery aneurysm, or it can be medical cause like hypertension or diabetes. So this is very, very important question, doctor. Oculomotor palsy is because of, फटाफट बोलो बच्चों, it can be due to surgical cause like any aneurysm of the pica, posterior inferior cerebellar artery aneurysm, or it can be because of the medical causes like hypertension, diabetes. How to differentiate? Diabetes, hypertension, like medical causes, spare the pupil. Pupil is not involved. But surgical causes like pica aneurysm leading to the compression of the oculomotor nerve compresses both the pupillary fibers and also the fibers supplying the levator palparis superioris. इसलिए ptosis जो होता है, ptosis will be there in both medical causes and surgical causes. But if you lift that eyelid, if the pupil is normally reacting, pupillary reflex is normal, then the medical cause, like hypertension, diabetes, is implicated. But if there is any pupillary involvement with the mydriasis, with the pupillary dilatation, then you think of surgical cause, like pica aneurysm compressing the oculomotor nerve. That is what you need to remember for the tomorrow's NEETPG. So, doctor, everything, if you logically approach, questions are all very, very standard questions, doctor, nothing to worry, right? Now, elderly, diabetic, new onset, cognitive impairment. He's taking multiple medications, including for urinary incontinence, diabetic neuropathy. What should be your initial approach? Very often, polypharmacy. So, all these so-called जनरल फिजिशियंस इंडिया में आरएमपी भी दवा देता है, मेडिकल शॉप वाले दवा देता है, पेशेंट अपने आप लेता है. It's polypharmacy in India. So, very bad habit for the clinicians is to combine nortriptyline with gabapentin for the pains. But this nortriptyline is tricyclic antidepressant, which also has got anticholinergic action. Because of that anticholinergic action, the bladder will go into stasis. There will be cognitive decline. So always there's a competition between dopamine and acetylcholine. If the acetylcholine level is high, your cognition is good. If the acetylcholine level is low because of your anticholinergic drugs, your cognition will come down. So whenever there is any cognitive defect in an elderly man, whenever there is any bladder stasis in an elderly man, you look whether he is taking gabapentin with amitriptyline, gabapentin with nortriptyline could be one of the important causes which you need to basically remember, doctor. Now, so always review the current medication. A patient with epilepsy unresponsive receiving multiple doses of benzodiazepines. There is no history of alcohol withdrawal, recent infection, any neurological, no neurological deficit. So persistent unresponsiveness after anti-epileptic drugs suggests a seizure etiology rather than sedative effects. Non-adherence of the AEDs, anti-epileptic drugs, is the common risk factors for the generalized convulsive status epilepticus. GCSE is what you need to remember. So what are the causes for the convulsive status epilepticus, doctor? Structural brain abnormality like medial temporal lobe sclerosis. Metabolic abnormalities, you need to look. Any severe hyponatremia is there. Any infection like meningitis, encephalitis, drug withdrawal, any of them can lead to convulsive status epilepticus is what you need to basically remember. So what is your when do you diagnose it as status epilepticus, doctor? More than 5 minutes of generalized convulsive seizure. More than 2 generalized convulsive seizures without interval. Recovery of the consciousness define the status epilepticus. A patient presents with a bilateral action tremor of the hands that worsen with the stress. So it is classical of essential tremor because it improves with alcohol intake. So such cases you can try propranolol. 32-year-old with a 2-year history of recurrent headaches. Headaches are unilateral, throbbing, often accompanied by nausea and sweating. She also sees flashing lights before the onset of headache. So always migraine with aura increase the risk of ischemic stroke. Estrogen containing contraceptives are contraindicated whenever the woman has got migraine is what you need to remember. So I leave everything about migraine with aura. What are the characters, aura symptoms, contraceptives, how do you manage, what are the abortive therapy, what are the preventive drugs, NSAIDs, triptans are abortive, acutely given. Beta blockers, calcium channel blockers are preventive for the migraine is what you need to remember. A 58-year-old man with a history of hypertension presents with 6 months history of hand tremors that worsen at rest, improve with movement. So whenever the patient has got a resting tremor, pill rolling tremor that worsens by rest and improves by movement, it is Parkinson. Trihexyphenidyl is appropriate for the patients under 65 who have got tremor dominant Parkinson. Tremor dominant Parkinson. So once more I leave to you in one single mind map everything, anything about the Parkinson's disease. Resting tremor improves with activity. Trihexyphenidyl for younger less than 65. Amantadine to avoid anticholinergic effects. MAO inhibitors for mild symptoms. Levodopa and dopamine agonists for moderate to severe symptoms. That's how you treat. Similarly, essential tremor, how do you treat? Propranolol, clonazepam, clozapine. For refractory cases, you can use clozapine, a typical antipsychotic. 63-year-old, history of poorly controlled hypertension. He has a right facial droop, hemiparesis, slurred speech, classical of hypertensive vasculopathy, where chronic hypertension is the primary cause of small penetrating artery rupture is what you should basically remember. 35-year-old firefighter, skin has a cherry red appearance. Cherry red appearance is a feature of severe carbon monoxide poisoning. You need to do oximetry of the arterial blood. 12-year-old girl brought to emergency. This patient has a persistent headache and vomiting suggests increased intracranial pressure. So, fever, focal neurological deficits like right leg weakness and hyperreflexia, they all suggest an infectious process of the CNS. You need to evaluate the brain for the presence of any brain abscess is considered to be the investigation of choice. Now, a 6-year-old boy with weakness in his leg after a mild respiratory infection, post-infectious demyelinating polyneuritis, development of a flaccid paralysis immediately after an infection is called acute flaccid paralysis is Guillain-Barré. So ascending weakness, paresthesia, recent infection, absence of deep tendon reflexes, they are all suggestive of demyelinating post-infectious polyneuritis, which is called Guillain-Barré. So everything, anything about Guillain-Barré you should know. I leave the literature for you in this mind map, doctor. Please do the revision. A 32-year-old woman with 2-year history of recurrent headache. Headaches are unilateral, throbbing. So typically this is a case of migraine with aura. So stop her oral contraceptive immediately because of the increased risk of stroke. A 58-year-old with a history of hypertension. So once more, there is a repeat of the question. Yeah. Now, doctor, a 30-year-old presents to fertility clinic after a year of unsuccessful attempts to conceive. He has a history of bodybuilding. So long-term use of anabolic steroids in the bodybuilder suppress the gonadotropin releasing hormone leading to decreased LH and FSH that lead to a decrease in the sperm production, which lead to, in the bodybuilders, problem of infertility. 25-year-old nurse comes to the clinic, painful vesicular lesion on the finger with a history of exposure to herpes is characteristic of herpetic whitlow. 22-year-old comes to the clinic, rectal pain and discharge. So rectal pain, tenesmus, fever, mucopurulent discharge in a sexually active individual such as gonococcal proctitis is considered to be the diagnosis. So 36-year-old with itchy rash with raised scaly border, central clearing, classical of tinea crudis. 80-year-old with the history of hypertension, type 2 diabetes with giddiness, lightheadedness upon standing, along with a significant drop is classical of orthostatic hypotension, especially in the elderly people. When do you call orthostatic? Whenever there is any postural decrease in the BP, more than 20, systolic BP decreasing more than 20 or diastolic more than 10 fall is called orthostatic hypotension. A 55-year-old with hyperlipidemia started on niacin therapy. So what are the side effects of niacin? Flushing pruritus because of the prostaglandin-induced vasodilation. So initiate a low-dose aspirin therapy before the niacin administration is considered to be the treatment. A 70-year-old male with a history of hypertension, chest pain or exertion. So whenever you want to do stress testing, when the patient is unable to exercise, we use adenosine. It dilates the coronary arteries to reveal the areas of the myocardial ischemia under stress. So adenosine stress tests are used especially whenever there is any limitation to do exercise. Like somebody has got a severe osteoarthritis, he can't run. So there we use adenosine as a pharmacological stress. A 68-year-old, mild confusion, nausea, serum sodium 128, osmolarity 270. So a low plasma sodium, increased urinary sodium, increased urinary osmolarity, classical of SIADH. Typically SSRIs, whenever the patient uses SSRIs, it can be associated with the development of SIADH is what you should remember. 45-year-old man with a history of renal transplantation with chronic cough, weight loss, recent onset of seizures, multiple lung nodules and brain lesion. Sputum culture show gram-positive branching filamentous organisms that are partially acid-fast. That is all pointing towards nocardia. Nocardia infection is treated with trimethoprim sulfamethoxazole is what you need to basically remember. So everything, anything about nocardia, you should know, doctor. In one mind map, you get everything. So I give to you, please go to the learnograph.com. I leave the link below. Go to learnograph.com. You find all the PDFs, ebooks for you to make a download. Just by paying $500, you can download a PDF. Take the question paper in exam conditions, like a real exam. Whatever be your score, it can be 50, 60 correct out of 200, 100 correct out of 200, doesn't matter. After that, there are 200 mind maps given. Each mind map will give you the correct answer, explanatory answer, and all the key points about the question. MCQ. Sit with a friend. Anyway, you are paying $500. Share that to another 2 to 3 friends, no problem, freely. But sit with them, discuss the paper, and then try to find out which topics you are going wrong. Like that, every day improve 20, 30 topics, 20, 30 topics. 50 full-scale grad tests. Once you finish solving, you become Gyani, super Gyani. And my whole goal is to not teach you. You don't need anyone to teach. What you require is self-motivation to do the revision. Is the voice loud and clear for everybody? Can you please punch, Dr. Ravi, Gautam, everybody? Can you please punch? Is the voice loud and clear for all of you? Yeah? Is the voice clear? Okay, thank you, Gautam. Ravi, is the voice clear all the way to Punjab? Is the voice from Hyderabad coming? Yes, thank you. So, doctor, a 58-year-old with history of breast cancer comes to the office. There's a possibility of metastasis. Always, how do you know, how do you inform the patient is all the way very, very important. So good to know Gautam Kumar is from Hyderabad. Very good, doctor, very good. So 32-year-old with CD4 count of 45, persistent fever, night sweats, non-productive cough. So the patient's HIV status with a low CD4 count is indicative of Mycobacterium avium intracellular infection, and the treatment is clarithromycin and ethambutol is considered to be the treatment of choice. 50-year-old with a history of hypertension and obesity, severe acute onset ankle pain with alcohol consumption and new aspirin use suggests that it is a flare-up of the gout is what you need to remember. So all the risk factors, diuretics, low-dose aspirin, high-protein food, high-fat food, fructose, sweetened beverages, high alcohol consumption, hypertension, obesity, chronic kidney disease, anything can be the predisposing. Whereas vitamin C, coffee, dairy products, they decrease the risk of the gout is what you need to remember. A newborn has bilateral conjunctival redness and discharge on the second day of life. Gram-negative intracellular diplococci is indicative of gonococcal conjunctivitis. Treatment is intramuscular third generation. Cephalosporin is considered to be the treatment of choice. A 6-month-old presents with murmur detected during a routine checkup. Infant is thriving well with no symptoms of shortness of breath. So a large VSD with a significant left to right shunt will produce a diastolic rumble at the left sternal border due to the increased flow across the mitral band. So one more important point I like to tell you, doctor. Every time you download the PDF from the learnograph.com, please download it into a laptop because each will be almost 500, 400 MB in space because they have all high resolution images of the mind maps. So if you try on the phone, some students will not get it correctly. So that is the reason when you buy it, download it with a laptop and nicely enjoy revision of that. Most important, paying money to the app, paying money to the coaching program, paying money to the face-to-face classes is only the start. Consume the content, inspire to do the revision. If you don't do that, we are failing in our job, but for running a commercial coaching program, which we are not interested to do, right? So we want you to send us a laddu in the WhatsApp saying that, sir, mujhe pediatrics aa gaya. सर आपने इंस्पायर किया, आप रोज पढ़ने के लिए एड्रेनलिन बूस्ट दिया. ऐसे चीजों के लिए हम वेट करते हैं. 3 lakh students I got a golden opportunity to inspire in the past 25 years, a quarter century, to become postgraduates, right? So I want you to be one of them, right, doctor? So 6-month-old with VSD, diastolic rumble is what you should remember. 30-year-old family history, sudden cardiac death with palpitations. So Two conditions, mitral valve prolapse, hypertrophic obstructive cardiomyopathy. These two are notorious to lead to a sudden cardiac death, is what you need to remember. Beta blockers are a part of the initial management because beta blockers reduce the heart rate. They increase the diastolic filling time. When the ventricle is filled more than the hypertrophic cardiomyopathy may, touching between interventricular septum and mitral valve will be less, and the left ventricular outflow obstruction will be less. So we want more diastolic time by slowing down the heart rate by giving the beta blockers. Good for the HOCM is what you need to remember. 17-year-old male collapses while running track, brought to emergency, prolonged QT interval. So sotalol is the class 3 antiarrhythmic that prolong the QT interval. So those who have long QT syndrome, you need to avoid, you should avoid the sotalol-like drug. So what are all the drugs that lead to prolongation? Class 1A antiarrhythmics like pyridine, class 3 antiarrhythmics like sotalol. They have an adverse effect of causing a prolonged QT interval is what you should remember. A 10-year-old boy with a swelling and pain in his knees, history of excessive bleeding, and a family history suggests inheriting bleeding diathesis, which is hemophilia in this case. A full-term newborn, ambiguous genitalia, enlarged clitoris, virilization, classical of congenital adrenal hyperplasia. 16-year-old girl brought to emergency with fever, with hypotension. So fever, hypotension, purpuric rash, disseminated intravascular coagulation, they're all suggestive of severe meningococcemia. It's called Waterhouse-Friderichsen syndrome, where there is a adrenal hemorrhage in fulminant meningococcemia is what you should remember. A newborn presented with a localized swelling of the right side of the head. So firm, non-fluctuant, well-demarcated swelling confined to cranial bones such as cephalohematoma is what you should remember. 2-year-old, history of prematurity, delayed motor milestones, hypertonia, they all suggest cerebral palsy. Cerebral palsy is what you should remember. 17-year-old, already we finished sotalol. Now, teenage girl, multiple hypopigmented patches on the neck. Dull wood fluorescence under wood lamp is characteristic of tinea versicolor, which is caused by melasthesia furfur is what you should remember. A 6-month-old infant, horrelled hyperpigmented streaks on the trunk and limbs is indicative of incontinentia pigmenti. Also, there will be hair, nail, and dental abnormalities. They all support the diagnosis. A 40-year-old recently immigrated, hypoesthetic, hypopigmented skin lesions, vaccinated against the leprosy, acid-fast bacilli. So the lepramin test is the one which is used to evaluate the cell-made immunity and immune status against the Mycobacterium leprae. A 30-year-old with well-demarcated erythematous plaques, silvery scales on plaques are classical presentation of psoriasis. What do you see in psoriasis? Parakeratosis, that means retention of the nuclei in the stratum corneum is the hallmark of psoriasis is what you should remember. A 35-year-old woman with sudden onset of swelling, so sudden onset facial and hand swelling without urticaria or the pruritus suggests angioedema. So it is the mast cells which are implicated in causing it. A 22-year-old athlete collapses. His brother died unexpectedly at 20. ECG show epsilon wave, T wave inversions in the right precordial leads. So a family history of sudden death in young athletes and characteristic ECG means arrhythmogenic right ventricular cardiomyopathy, where there are mutations in the desmosomes which are part of the integumentary system is what you need to remember. 32-year-old, multiple flat-topped violaceous papules on her wrists and presence of any new lesions in the area of trauma, characteristic of Koebner. So typically this patient's lichen planus, there also we find the Koebner's phenomena, that is called Koebner's pseudomorphic phenomena is what you need to remember. So everything you should know. What is Pegetoid phenomena, Renbach phenomena, Brock's phenomena. It is also seen in lichen planus. Subepidermal hemorrhage with scraping is called Brock's phenomena. A 45-year-old, oral ulcer, flaccid bullae. Extension of the bullae with gentle pressure is called Nikolsky's sign, which is classically seen in pemphigus vulgaris. Because of the fragility of epidermal dermal coaching is what you need to remember. So, sir, please provide key after discussion. Key is already there, no doctor. Key is already there. Here you have no correct answer. You are having. So this is how the key is there. So please, Anita, you download the ebook and kindly review on the ebook so that you will get all the answers. It's not just the answers. What you need to do, you need to do the entire revision. That is very important, of the entire high-yield facts on the topic. 55-year-old male with a history of hypertension, diabetes, episodic chest pain, thallium stress test, so left ventricular dilatation, large reversible defects. So stress-induced dilatation, reversible defects such as ischemia because of the coronary artery disease. So where we use thallium scan, which shows high risk pattern. A 30-year-old female with a history of palpitations, high BP, hypercalcemia, palpable neck mass, So Sestamebe scan is ordered. So family history suggests you of primary hyperparathyroidism, often due to parathyroid adenoma. A Sestamebe scan is a nuclear medicine test for that, is what you need to remember. So, मेरे प्यारे भारतवासियों, हम रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होके दुनिया को बताएंगे, भाई मेरा नंबर आ गया और मुझे टॉप 1000 रैंक्स ऑल इंडिया रैंक मिल गया. And that day I'll be waiting, I'll be dreaming that you will become the toppers tomorrow, great consultants, and treat millions of people who are passing through a greatest suffering of morbidity, improper diagnosis, etc., etc. So good night. With that dream, let us fight the game. Thank you very much for attending.